దీనిలో చూసి కూర్చోండి. నాకు దీంట్లో ఎందుకు రాదు? It's coming? Okay, good. Good morning. I believe I am online, though I can't see myself for some reason. But I think we should start. I'll put the fan. Listen to background noise. All right. So today let's talk about an introduction to embryology. Just as I tried to give you an introduction to histology as a science, which we shall pursue as a component or a subset of the entire anatomy study. Similarly, embryology is one more subset running parallelly, but the patient, the subject, the client that you study is an unborn human being, and we explore everything about the stages of that individual life before it is born as a child or a baby into the world. Now, one way of looking at it, the philosophical, the literature, the cultural way of looking at it, it has been very lyrically and very beautifully, very sentimentally, emotionally described. The unborn life, its sophistication, its miraculousness, its vulnerability, its preciousness in terms of the potential for a whole human life, all that a man or a woman can be. But the scientist, the biologist, the embryologist, learns to look at it as a progression, a dynamic progression of possibilities and potentialities. So you're looking at a whole organism, but you're also looking at its component parts in very specific ways, and you're looking at the rich interplay of how these component parts are going to move and change with each other, sometimes despite each other, sometimes with the help of each other, often simultaneously at the same time with each other, but completely not interacting with each other. Though the rules tends to be that everything impacts everything else. There are areas where you have discrete, separate development happening in its own track, on its own timeline, and something else happening which looks like it has got nothing to do with that. But when it appears to you as a pregnant lady with an unborn child and some problem, or as an incidental finding in a scan that we do, we must know enough to remember that, oh, I'm seeing this, I must check for that, because at this same time that might have happened. Right? So the timeline, the temporal relationship of tissues and organs and systems to each other, the spatial relationship, because they are occupying the same body cavities, they are right next to each other, they are juxtaposed for some part of their lives, after which they may migrate and go away somewhere else. But for those few hours or few days when they are very close together, some interaction may have happened. It is a complex science, but it's very, very fascinating because we see its impact in the born person, but we may not see it immediately. We may see it sometimes years, sometimes decades later. In the 50s or 60s, we may see the actual effect of what happened when that person was still unborn. So, clinical embryologists fetal medicine specialists. They have put together this whole sequence of events, what is happening silently, quietly inside, which may suddenly pop up as a patient problem for you. And you must at that time know enough embryology for it to strike you that this could be a clue of development basis, not something the patient ate or something the patient did in the last few days, but something the patient underwent as an unborn baby in his mother's womb. It becomes very important. It's rare. Genetic diseases, congenital abnormalities are comparatively very rare, but very important because, in the first place, that may be the thing which is eluding escaping diagnosis and giving a lot of trouble to the medical community. They're not able to figure out what's wrong with this person. That's because it is an unchangeable defect which has developed long time ago, probably. Or they have to keep that as one of the rare possibilities always in the differential diagnosis when they're looking at a particular problem. Or they are picking up something in the unborn stage itself, and then it becomes a huge ethical gift, or how should I say, offering we can make as a medical caregiver to the parents, that this is the situation, this is its likely progress. You can still take a decision whether you want to have this baby or not. Finally, the decision is of the parents, but you can offer some help in preempting or preventing what can be a lifelong difficulty and burden for the parents. This is the basis. This is the real living basis of why we teach you embryology. So let's just get on with it. Few slides, I'll try to finish them quickly. I want to acknowledge with deep thanks these slides prepared by my colleague, Dr. Hema Bindu. She's professor of anatomy. She was the previous HOD here. She has moved on to another job. But I've known her for a very long time. She's one of my very close friends. So with her permission, I'm utilizing her slides because she has a wonderful compilation. She is a fetal autopsy specialist. She's an antenatal ultrasonologist, in addition to being a very brilliant anatomist. So she shared her collection of images which she picked up during her sonology live scans of pregnant ladies. So I wanted to share that with you, just to bring alive to you that this is why you learn this very difficult, very challenging part of anatomy called embryology, because at the end you'll have this little life in your big hands. Okay, so let's go. Right in the beginning, in the history of embryology, long ago, they were weird. Now we say weird, but in those days that was important. They actually believed it. They believed the fetus developed from a coagulum of blood and semen in the uterus. At least they identified that the uterus correctly, that it's the place where a baby grows. They also identified that the semen would somehow reach this uterus and somehow form the baby. But they also identified that blood is being formed in the uterus and it is being released or lost every month. So disparate pieces of real information people had. And the earliest biologists, doctors, they put together that and made a theory that this blood in the uterus plus the semen which reaches it together form the baby. It's not too wrong, but it's of course not right, isn't it? We got to know the real truth, the scientific truth, slowly, bit by bit, as our instruments of investigation improved over the last so many centuries. So this is an illustration of how there was a lot of blood. I don't know where the semen is supposed to have entered from, and then it forms networks and networks with, I think this was supposed to be, because they've seen the placenta once it is delivered. So this network-like thing was coming together and forming the outline of a baby and then finally becoming a human being. Leonardo da Vinci, brilliant person of the 16th century. He might have actually seen dissections of women who might have died in childbirth, and therefore they were able to dissect the complete pregnant uterus with the unborn baby inside it, and then he was able to make illustrations like this from that. It's morbid, but it's fascinating because they gleaned information from a very difficult, very messy, very, people had all kinds of superstitions about women, about babies, about birth, about life, about, you know, that the whole social structure of the Dark Ages was pretty bad. So coming out of that, the 16th century was really the beginning of light, the light of reason, the light of knowledge, the light of clarity, coming into the understanding of scientific processes. Illustrations showing that as if every sperm, the head of the sperm, neck and tail of the sperm, is like the head of the baby and the body and the limbs of a curled in baby. It's as if this is a prototype. Every sperm is a potential full human being curled up inside, which can go and become a person. At least the concept is not wrong that every sperm, not the whole fluid of seminal fluid, but every individual sperm in it has the potential of becoming a full human being. So clarity is slowly developing. It's not entirely right, the picture, but some glimmerings of wisdom are happening, right? Now, 20th century means in the 1900s, when I was a young person, you guys were still not born. Lots of very rapid advances happened. So they were able to, when an abortion happened, they were able to see embryos, sometimes full embryos, which have not got disintegrated in the process, and they were very transparent, thin biological material, which they examined with great care and under magnification and tried to note down the details. They used vital dyes to stain living cells, and the living cell will hold the dye and keep on progressing in its own life, and it might change and it might do something, it might secrete some things, it might absorb some things, it may interact with other cells. So they were able to follow the fate or the destiny of living cells, which was a great step forward. Radioactive labeled and autoradiographic techniques were developed, which is a whole branch of science which allowed us again to watch a group of cells or an area of study over a period of time and see what is happening to the tracer molecule which we have introduced, which will give us an idea of the function of that tissue or the cell. Then grafting experiments were done, which is amazing, not in human embryos, at least till lately, but in other animals, especially reptiles, newts and salamanders. Lots of work was done, where they would take a little bit of the fetus, the embryo tissue, and graft it, that is, cut it away from its own place and go and stitch it up in another place and see what will happen. And they found that the embryo development continued because they kept the animal alive, the small animal alive, and they saw what will happen to that structure if it is attached somewhere else. Will it be able to get its own blood supply? Will it be able to grow and develop and form the same part which is originally intended? Or will it now form a part depending on the place where it has been transplanted? And so on and so forth. Very fascinating, very, very bold and forward thinking experiments. Teratology is the science of birth defects. Teratos means monster. It's a cruel word, but it is a reflection of the long, cruel history of human medicine. But in the 60s, new drugs which were being used in the market, one of them called thalidomide, had a very detrimental effect on the babies born to the women who used that drug. It was a small antiemetic. There's a nausea associated with pregnancy, so this thalidomide was supposed to suppress the nausea, and it was doing that well. So lots of pregnant women started taking it. And then they found that too high a proportion of such ladies who had been prescribed thalidomide, their babies, their limbs were not forming properly. The hand and palm part of the limb was directly being attached to the shoulder, to the torso. The in between arm and forearm part was not developing at all or was not developing well. So it's like the hands are attached at the shoulder, so like flippers, right? So one way of describing it, those babies, was seal limbs. They had seal limbs. They just had flipper like attachments at the shoulders and at the hip. They didn't have the formation of the long limb bones. The bones didn't form at all. Those regions didn't form at all. So phocomelia is the name of this defect, seal-like limbs. And for the first time, an association was made between a drug or something you consume and that it can result in a mistake, in a side effect, not on the person, the adult who has consumed it, but on the unborn child which is being carried by that person. So, major step to directly see the correlations. Earlier, many things were surmised. They would not allow pregnant women to eat certain things, or to behave in certain ways, or to move in certain places or something, because they said if you do this, this will happen to your baby. So you have to be careful or whatever. So many of them were old wives' tales, but there was a kernel of truth in many of those tales. But this time there's a scientific direct correlation between the consumption of something and its impact on the developing tissues of your unborn child. Then molecular approaches have been added. So even more scientific progress, even more, how should we say, evolution of other sciences, not medical science, but other sciences. And therefore, fluorescein and fluorescent marking became possible, so we were able to use probes in biological processes which we are studying within embryology and genetics. Right? So you take an application which is happening in some other science and you put it into your own science, and suddenly new possibilities of experimentation happen in your own science. So that's what happened. And from cytogenetics, a whole branch of molecular genetics was able to develop. Why we need to put in an established basis of embryology in your head before you go into clinical medicine, because very often, even while you're studying gross anatomy, through the adult structures that you will dissect, the why is this thing the way it is, a good amount of explanation comes from how it was to begin with and then what happened to it. So for example, in the beginning the stomach was a fusiform tube, right, spindle shaped tube, and you had a vagus nerve which was accompanying that gut tube along its long axis for all its length. And then when something happened to the stomach tube, it twisted on its long axis. It bulged out at one side and became less curved on the other side. The nerve which was accompanying that aspect of the stomach wall moved along with it. And so the position of the vagus can be expressed or can be explained with the way, because it got moved by the movement of the gut tube which is developing into the future stomach. But the vagus by itself didn't change, didn't grow, didn't take a decision and do something different between the left and right side. But something else with which it was associated underwent a change and transformation, and the nerve took up its position accordingly. Right? So we will do this in detail as we go along. Embryology also explains the causes of variation in human structure. Sometimes you will see, for example, the blood supply to the gallbladder. The artery, the cystic artery coming to the gallbladder, can come as a branch of right hepatic artery, can come as a branch of left hepatic artery, can come as a branch of common hepatic artery, can be a combination of these. There are 5 or 6 variants, which means in 100 people, some people, 30 people will have type A, 20 people will have type B, like that. So 6 different, and all of them are normal, in the sense all of them do the function well. The blood supply to the gallbladder is completely competent. There's going to be no problem. But when a surgeon goes in and wants to do something in the area, he has to be aware of all 6 variants, so that he will not dangerously put a scalpel in an area where a potential artery could be, because that will it will create a bleeder in a surgical field, and that's a big mess. Apart from the blood loss, it's a risk to the organ that we are trying to operate on. So this causes a variation in human structure we can understand better, because we will study how the gallbladder developed, then how its blood supply developed, and then what all could have happened there, which is why you can have different patterns. Whereas in certain areas and certain organs, in certain regions, you will have only one pattern. There will be absolutely no variation at all. No chance. And if there's any small variation from that, it is detrimental. It is a risk to that part of that organ, or it is a reason why that particular disease developed. So there's a whole spectrum. You can have variations which are all compatible with life and with good health. And then you can have anomalies. We use a different term called anomaly, where that variant may be all right if you're lucky, and you may live and die without even knowing that you had an anomaly. But on the other hand, it may make you vulnerable to a particular development of disease. So all the basis of that is embryological development. So pathogenesis of birth defects in babies is also explained by embryology, because at a certain stage of the human fetal development, the mother or the baby's environment, that means the inside of the uterine compartment or the inside of the placental environment, got exposed to some external agent, too much heat, too much cold, certain kinds of um, drugs you meaning the mother might have taken, any infectious agents which might have infected the mother, some x-rays which the mother may have been exposed to. So we can exactly predict what it is that the mother underwent which caused this particular change at this stage of the pregnancy for that particular fetus. That's only explainable by knowing the embryology basis of it. Now there is a whole branch of medicine called fetal medicine, because modern medical science is able to intervene and correct things in the unborn child. Hitherto, this was not very easy. We wouldn't put even a needle into the pregnant uterus because there is a risk of it getting irritable and going into spasm, labor too early, and then you lose the baby. Right? We don't want to precipitate uterine cramps or uterine contractions until 40 weeks of pregnancy are over, at least 36 weeks. A baby is not viable for independent life outside the mother till at least 28 weeks life. So we don't want to intervene by doing an investigation like drawing a sample of the fluid, the amniotic fluid, where a needle is being put and you can draw a sample of fluid. Or we don't mind putting an ultrasound transducer and getting some information through images like this, black, white, and gray images, because of the sonolucence or the sono opacity of the particular tissue through which the sound waves are going. Over the decades, it has been established that this is the cleanest, greenest form of energy. It will not leave any residual impact, it will not disturb any function or structure inside either the mother or the baby. It's a very safe investigation, which is why it's always the first modality of choice if you want information on the pregnant mother, either on the woman's internal organs or of the developing fetus. We prefer ultrasound as first choice rather than doing any other kind of investigation. So the whole science of sonology, antenatal sonology, has become a basis of developing the sophistication of fetal medicine, where with the best magnification, beautiful 4D imaging, you can see the contours of the fetus face, fingers, fingertips, hair on the skin. That high resolution we are able to get. The fine lanugo of the unborn baby's skin can be made out with shades of the image. The point I'm trying to make is with the level of clarity that we are able to get in these imaging studies, we are also able to take the courage to try to intervene, because at the same time, the risk of putting a needle, putting a knife into the uterine cavity while the baby is still unborn, we have brought it down by developing other molecules, other medicines, which will calm down the uterus and not allow it to get irritated into a reflex contraction. We are able to give supportive medication, do actually surgeries on the unborn child, in which case we can correct congenital defects at a stage of development where if you change one little bit of tissue, the wrong tissue that it is headed to become will not happen. If you will correct it to become the right tissue that it is supposed to become, you are at the fringe of really miraculous medicine. Embryology is the basis of all that. So how we say it is that healthcare strategy is what we are able to offer to the parents, that you will have a better reproductive outcome because this possibility is there. We'd like to offer you that this surgery or this intervention before your baby is born, so that he or she will not have a lifelong weakness or deformity to live with, which has no cure, which is absolutely no medical management possible later. Human development is a continuous process. It starts at the fertilization of the male and female sex cells, the formation of the first single-celled new organism called a zygote, which is a totally powerful cell, which transforms into the multicellular human being. During this, it passes through many steps, and these are called cell division, cell migration, programmed cell death or apoptosis, cell differentiation, growth, and cell rearrangement. Growth could be in individual cell size or in cell numbers, we will see as we go. Differentiation is a process in which a group of cells will take on a particular common special characteristic, which will allow them to perform special functions and which will mark them as a separate group from all the other cells which can't do those things. Therefore, this differentiation is the basis for different tissues developing along different pathways, or what we call histogenesis. Histo is tissue, genesis is birth. So at the totipotent stage, the zygote and its immediate generations of mitotic cells are capable of everything. They can become skin, they can become brain, they can become bone, they can become thyroid, they can become knee joint, they can become toenail, you name it. After a certain stage, that is not possible anymore. That is a stage where differentiation has set in, and one set of daughter cells has acquired characteristics and functions, differentiating it from another set of daughter cells. So totipotent means it can become all cell types, including another embryo. It can make two babies, technically, and that is the first stage in the development of identical twins. We will come to that in detail later. It can become placental tissue. The zygote is capable of its destiny is to become the entire fetus, the fluid cavities in which the fetus is bathing, and the placenta and tissues which are nourishing it, which are connecting it to the mother's circulation. All that bunch of differentiated tissue is all the product of that one zygote. It's coming from that one diploid new organism cell. Right? So such a cell is called the totipotent cells. Only the zygote and it's up to its 8, 1 becomes 2, 2 becomes 4, 4 becomes 8, only up to that stage. 8 cell blastomere stage. The cells are all totipotent. After that, they become pluripotent. They refer to a stem cell which can differentiate into any one cell type. Not all cell types, but any one cell type, the basis of which I have already mentioned to you in the last class. 3 germ layers of endoderm, mesoderm, or ectoderm. So these are the basic, that's why we call them germ layer. Germ in the sense germinative, what will give birth to, what will arise as different types of cells. So a pluripotent cell is already committed into either endoderm type or mesoderm type or ectoderm type of derivation. It is not totipotent anymore. So you have a sperm and you have a oocyte together. Immediately they'll form the zygote, which will progress into 2, 4, 8, 16, 32. The morula stage, mulberry, it looks like a mulberry. And then it moves, if you examine it, if you cut it and see, you see it's developing a cyst-like liquid-filled cavity in the center, the outer layer of cells and an inner layer of cells. Right? And once this outer inner positioning has happened, the characteristics of the inner layer changes and is differentiated from the characteristics of the outer layer. So the outer layer, though it is pluripotent, becomes committed to form only the adhering structures. What we call it the adnex. We will look at that when we come. And then the inner mass of cells, only the blue ones in this case. In life, there's no blue and yellow. This is only for illustration purpose. The inner cell mass, all of it together, retains the pluripotency to be able to become either A system, B system, C system, all the 10, 12 systems that you have in the body. Once it is committed to one system, then it becomes unipotent. It can only do one kind of thing after that. So between pluripotent and unipotent, several generations of divisions might have happened. But finally, even within any one system, there will be different kinds of tissues. We already said there were 4 basic types of tissues, right? Last class we said there was epithelial tissue, connective tissue, muscle tissue, and nervous tissue. A combination of these, especially connective tissue has so many subtypes, will form any one organ. A combination of organs will form an organ system, right? So potentiality is getting less and less. number of cells, number of possibilities, specialization is getting more and more. The multipotent progenitor cells have the potential to give rise to cells from multiple lineages, but a limited number of lineages. So another word, pluripotent, multipotent is the same thing. It can give rise to 3, 4, 5 lineages of cells. For example, the hematopoietic or hemopoietic stem cell is a blood HSC, hemopoietic stem cell, which can differentiate into blasts, which will become white cell type, or it can go into a myeloblast, which is a subset of again white cell type, till here. Or the same progenitor can go into the erythrocyte lineage, or it can become a megakaryocyte and go into a platelet cell lineage. So the same hematopoietic stem cell can take 3 different lineages, but the end point will only be a blood cell. It won't be of any other kind of tissue anywhere. So such a kind of differentiation progresses. It can't become any of the other core tissues like a brain or a leg or anything like that. Once it has progressed beyond a certain stage, only one cell type is I'm capable of producing only one cell type, then I become a unipotent or a precursor cell. Another way of saying is I can produce many thousands, but only one type. Right? So usually we call these the blasts. They are committed to form only one type, any number of times, any number of cells throughout the life. Right? So these would be unipotent or precursor cells of the type. Now, the final type is the mature cell which actually does the job. A hepatocyte does the job of a liver, whatever a liver needs to do. Right? Similarly, a kidney cell will do the job of what an adult mature kidney should do. Right? Or a myoblast will give myocytes, and the muscle cell will do what contraction it needs to do. So the mother cell stage is still where you have a progenitor type, and then you have a commitment to only one cell type where you can call it the whatever X blast, myoblast, erythroblast, hepatoblast, right? It has more potential of division than a hepatocyte. Hepatocyte will not divide further, right? Or maximum it will divide once or twice, can't do much. Whereas a hepatoblast is like a pool, like a reserve, which can keep on doing a lot of this cell type. So it is unipotent, and we call it the precursor cell of the hepatocyte. There is a phenomenon called apoptosis. We talked about it, the programmed cell death. So it is a normal component. It has to be able, it is nothing to, cell death, if you use the word, everyone gets very serious about it. But if death does not happen to certain types of cells, then the shape or the size or the function that we want will not happen. So to begin with, for example, we have the development of the limbs, the digits here, or parts, where this is a different species, I think. Or is it already the fetus? Looks like an ultrasound image. It's a fluorescent image. So what we're saying is that to begin with, the limb buds are going to have web spaces which are all filled in, because it develops like a plate of tissue. And then these bars or ridges develop. So the ridge part is what we need to develop further, but the in between the ridge part we don't need anymore. So cells in that region will have to undergo apoptosis to allow this separation to happen. There is no other way, right? So cells have to pre-decide and agree to die, so that the other remaining regions will go up and do the future function which they were destined for. That is why a programmed cell death is wired into your genetic program, right? And it's normal for multicellular organisms like us. We have a zillion cells, so all our cells have to pre-agree that some of them will have to die for our growth and development to take place the way it should. To bring this about, some stimuli have to happen. Otherwise, in this environment, if there is no reason that why would a cell want to die, or why would a life process allow a living thing to die. So there has to be a stimulus which will bring about a trigger which will say, okay, now these guys have to disappear. So then apoptosis takes place in a very controlled and regulated fashion. Okay, these were concepts of what you need to know on the basis. Now in human development, in practical terms, we divide it into a prenatal, before birth, and a postnatal. They're very clearly cut, demarcated events, life events, vital events, which you can't miss. I mean, which everybody knows, right? It's not only a medical science thing. Everybody knows that you have a prenatal life and then you have a postnatal life. So this is uniformly agreed terminology in laypersons also, in medical services, healthcare professionals also. It's very clear that before birth is something and after birth is something else. And this is also biologically significant because at the moment of birth, we're changing from a intrafluid compartment life to a outside in the air kind of life. It's a completely different environment that that little organism has to adapt to. Therefore, internal changes, external changes will have to happen, right? And we will talk about all the changes which happen at birth. I'm just familiarizing you with the terminology right now. In the prenatal period, before birth period, we again divide it further into embryonic and fetal period. That means for a certain stage, we will call that unborn an embryo. After a certain stage, we will call it a fetus. The embryonic period is the first 8 weeks. Okay, so the first 2 weeks, the zygote is still becoming 2 cells, 8 cells, compaction, 16 cells, 32 cells, a blastocyst with a blastocele, a liquid-filled cavity, an inner cell mass, and a naming of different cell types now, which means they are all different. They are beginning to become different from each other. So the first names you will come across is trophoblast, right? And so on and so forth, so many names. So in all this is happening in the first 2 weeks of life. From age 3 of weeks, age 3 weeks to 8 weeks, rapid differentiation, rapid migration, proliferation will happen and give rise to all the organs of the organ systems. So progressing from the single cell till the formation of the primordia of the organ. Primordia is the early version 1 of the organ. ఫినిష్ చేసేస్తే సైన్ కూడా పెట్టియచ్చు మరి అది కంప్లీట్ అవ్వకపోతే ప్లీజ్ ఎక్స్క్యూజ్ మీ జస్ట్ గివ్ మీ ఎ సెకండ్ నేను ఒకసారి చూస్తాను వెయిట్ చేయమని sorry, I'm conducting a pre-final exam for your senior batch, so that's happening parallelly. Sorry about that. So I have to get back to them. Let's finish this topic. This organs and the systems which they will belong to start happening during this period, and the word we use is primordia. That means the early version, the immature version. Why immature? Because it is not looking like or functioning like what it will do after birth and for the adult person, right? But it is still the same organ, and at that stage where it is forming, it is doing important things in that 3 to 8 week period, but it is able to do these things while rapidly transforming itself. So it's really great. It's like dynamically adapting to what is the requirement in your environment, and all this is a play out of the genetic blueprint that you're carrying within each of your cells. Some tissues will implement the blueprint in a certain direction, right? And other tissues will say, no, I don't have to become the scaffolding, I have to become the cement. So I will do this, I will become like that, I will go here, I will be located here, I will spread like this, I will maintain this feature so that I can do the job that I'm intended to do. The fetal period is the next segment of life where organogenesis has happened. All the organs are in place. All the organs, your digestive tract, every part of the digestive tract, all the little primordia of all the digestive glands, everything has already come, it's already in place. By the end of 8 weeks, your circulatory system is in place. Your respiratory system, though you aren't going to take a breath for 9 months, is in place. Endocrine system, all your systems are in place. The organogenesis is a very significant period of both growth and development and differentiation. From 9th week onwards, differentiation continues, but what is happening is bulk, more amount of cells and growth in the size of cells. Both are happening. So fetus grows, gains weight, the whole body wall, the whole structure of the fetus develops a lot. 9 weeks is where in the fetus the baseline organ systems are already laid down. You got the shape and size and the kacha map of what this creature, this species is going to look like. This individual of the species is going to develop, is going to play out into more mature forms of what is already there. So what needs to be there is already there by 8th week. Scientifically, we divide them into what are called Carnegie stages. So at 1 day, 2 days, this change in size is less till about 8 sevens. We said first 8 weeks should be about 56 days. So till about here, right? So the number of days is not exactly the same for each of the stages because the criteria by which we separate the stages are different. They're both internal and external, and they've been laid down and they've been accepted by the embryological community that this is a useful way to segregate the stages of development because it gives us useful insight and information on what to predict, what to be able to intervene, what to be worried about and look for, what to be cautious about. So it is mappable to number of days of life, but it is not equally spaced, right? And it goes on. So we have up to 23 stages. So up to the 60 days, that is your first 8 weeks of life, we have divided it into 23 Carnegie stages. And in each of them, what is happening, we will see. So by that 8 weeks, the whole embryo is only 5 millimeters. That's small. You're looking at a very high magnification. But everything that you can make out that this is a future human baby is already available. The limbs are correct. The tail has gone. It's completely regressed. The eyes, ears, nose, mouth, face, skull are of human proportion. Very similar to human proportion. We are still very, very close to primate development, but already differentiable that this species is recognizable. So we can create and have created timelines because for us, this unborn person is inside of another person. Who is your patient? Your patient is actually the mother, not the fetus, right? So we know that from her in her life stage, we are trying to track which stage is the baby at and what should be its healthy position right now, depending on the mother's symptoms, right? So what information the mother will give you is of her menstrual cycle. She'll say this was the date of my last menstrual period. Then we can predict that the menstrual period day 0 is when the entire lining of the endometrium is shed. So she couldn't have ovulated for at least 14 days. So fertilization could have happened only between day 14 and day 21. If fertilization has happened on this day, then the embryonic page of stage 1 to 23 is for these first 8 weeks. In this week 1 to 4, 5 to 8, minus of that is when fertilization has happened, more minus of that is when the menstrual period. So we can put a calendar of what must have happened depending on the history the mother gives you. Sometimes that's not very accurate, but to some extent within a certain range we can. And if you're having in the embryonic period, if you're seeing stages with ultranatal or with other scientific investigations, we can determine these stages very correctly and then work backward and say, oh, this is when fertilization may have happened. And whatever history she has given of LMP, last menstrual period, may have been a little plus minus. She got the dates wrong, or there was a false spotting, or there was a missed period. Whatever it is, we will be able to correct that. That's not significant. What is significant is to get the fetal stage right, so that now we'll be able to prove what's going to happen next. How should it, now that it is 5 weeks, what can we expect from now onwards? And then you can predict to the mother and say, okay, right now your baby is 5 weeks, we need another 36 weeks or 34 weeks for the pregnancy to get over, and so on and so forth. So earlier we had only the mother's history to rely on. Now, because of the sonology, because of the imaging technology which has improved so tremendously, we can do a lot more predictive, preparative activity for taking care of the baby better. The zygote is such a pretty picture, right? Two cell stage. The ovum is still within its zona pellucida. This is cytoplasm, and these are the pronuclei, male and female, and the polar bodies of the first division that is going to result from this zygote. This is going to immediately become a two-cell stage. So the events which will happen during this progression of the development timeline is zygote formation, morula formation, blastocyst formation, bilaminar germ disc, and the baby will undergo, not the baby, the fetus will undergo a hatching and an implantation into the uterine lining. By the time trilaminar germ disc will start, and the ball of cells will undergo a process called gastrulation, and the embryonic plate, the baby is in the form of a mass of a soft plate of cells, will undergo a folding, craniocaudal folding, and a side to side folding. At the same time, somatogenesis is happening inside. Cardiogenesis is, somites are paired groups of soft tissue, connective tissue bundles which are happening inside. Cardiogenesis, the circulatory system has already been demarcated and heart formation has started. Nerve formation has started. Special sensor formation has started with what we call placodes. So you learn a whole lot of new terminology. Don't get afraid of it. It's more fascinating than frightening, right? So look at it with the awe of, oh my God, so much is happening in that little structure over such a short period of time. So the terminology that you will learn: in anatomical position, we said superior, inferior, anterior, posterior, very clear, because an adult is able to stand bipedally erect, facing in the front, palms facing forward, and so on and so forth, right? Feet flat on the ground. But a fetus is not like that. Your fetus is all curled up on itself in many ways. So the whole head end is bent almost to touching the anterior abdominal wall. So we don't use anterior anymore. You use the word ventral. The whole this surface from here to here, the whole curved, concave surface is the ventral surface, and the rest, the back side of it, is the dorsal surface, the back, where the future vertebrae are going to develop, right? And the head end, here there is a head and there is a foot. Here there is a head end of the development, which is differentiated by being very large and bulbous in nature, compared to the narrowing, tapering, tail-like other end. So we call it the cranial end and the caudal end, ventral and dorsal side or surface. When we cut it, we already said, if you're cutting it parallel to the hemisymmetrical midline, we call it the sagittal plane. Same term, we can also call it, if it's exactly in the midline, we call it a median section. Parallel to that, not in the midline, but still on the same plane, is sagittal plane. If you're going to cut it lateral wise, then we call it a transverse section. So the slice is going to make transverse slices or axial slices, remember, through the fetus. And another way to slice the baby and see the developing parts inside is a frontal or coronal section. An ovum is the female sex cell. The word is derived from Latin. Sperm is derived from Greek, and it has head, body, tail. I think we've done all this before, and we'll do it again when we do fertilization and cell division and so forth. The zygote is such a pretty little. Now we can add color to the images that we see. And it's very beautiful. My generation didn't have the luxury of all this. We had those black and white pictures from certain high magnification studies, and even that was great development. Others, it's all imagination. This came like that did like that. There were 2,000 names you've given to everything. Embryology was very, very tough when we were students. Now you have brilliant imaging, so easy to visualize and to remember. But you have to remember the terminology. Zygote is a cell that results from the union of ovum and sperm during a process called, but the whole process is called fertilization. There are several stages of it. It's an exam question, so we'll come to that. The embryo is the developing human in the first 3 to 8 weeks of development. We already talked about that. After that, this is actually an embryo in situ, inside the uterine cavity. We've taken it out as it looks. The conceptus is the embryo plus everything else which has developed from the zygote, right? Like I used this word before, adnexa, right? So the embryo is the individual new human being, and everything else along with this new human being which has developed from that single cell zygote is called its adnexa. This plus this both together is equal to conceptus. All structures that develop from a zygote is equal to conceptus. It consists of all these parts. We will see. This blue one is the embryo. It's covered by a green bag with fluid. That's covered by a purple bag with fluid and an extra red structure and another bag with yolk in it. All of this together is developed from the zygote and therefore is called the conceptus. The word I used before, primordium. Another word we use is anlage. Very rare, very rarely we use it. But remember that it is an embryological word. Rudiment we say because it is not showing the structures of the parts or the features of the mature active organ, but showing the beginnings of it, just showing the possibility, the potential of becoming that mature organ. So for example, you'll have a limb bud, right? We can call it a rudiment. It is only showing the potential of becoming a limb, right? So the future brain area, the future face and neck area, the heart area, the liver area, the areas, the bulges, their components are rapidly developing. We use the word primordium for that, right? So we can say lower limb primordium. Easy to say bud because it looks like a bud jetting out from the body wall. And these, can you see these bulges? This 1, 2, 3 parallel bulges. These are called the somites. So all of these are primordia which are on their way to becoming something else. It's a term we use. You have to become familiar with it. The fetus is a word for the unborn offspring, and this is the human being after the embryonic period. So there is prenatal and postnatal. Postnatal is you after you're born. Prenatal is embryology. In prenatal there is embryonic stage and fetal stage. Embryonic stage is up to 8th week. Fetal stage is from 9th week onwards. Postnatal period, what will happen to you? From birth up to the first month, we call you a neonate. After which, up to the first year, 12 months of life, we call you an infant. And the period is called infancy. After the 13th, from 13th month onward, till you attain sexual maturity or puberty, we call it your childhood. And the patient is a child. From the age of 11 to 19 years, puberty will happen. It's not a on the spot one event, but it is a sequence of changes resulting in sexual maturity and possibility of reproductive capacity. That whole period can range over a period of time. In medical terms, we call that whole period adolescence. That's rapid physical and sexual maturity of that individual. It ranges from 11th year of life to 19th year of life, inside of which puberty will happen, which is the development of secondary sexual characteristics and sexual function. In females, that takes place between the age of 12 to 15 years, and its external manifestation is the starting of the menstrual cycle, which shows maturity of the ovary inside and indicates, if external bleeding is happening, that the whole female reproductive axis has been developed properly, and it is resulting in uterine endometrial shedding, which probably means that the whole ovary, fallopian tube, uterus, adrenal, hypothalamus function is good, right? Same thing in males. It's between approximately the age of 13 to 16 years, so it's within the period of adolescence where the male sexual maturity is happening, which means testes are producing spermatozoa. The other organs of the male reproductive tract are producing their secretions, such as the prostate and the other glands, and they are joining it to the seminal fluid, and the little boy is capable of producing and ejaculating the sperm within the seminal fluid and therefore of fathering a child. So to become a sexually mature man. Manhood in biological terms is the age of puberty. Similarly, womanhood in biological terms is the age of puberty where secondary sex characters develop. In the female also you have the development of the mammary gland and so on and so forth. So breast growth and maturity, it happens. Again, there's a range. It doesn't happen as one short period, but over a period of time, the development takes place. Inside of adolescence, while all this physical biochemistry is physical and biochemical changes are happening, the mind is also changing. The psychology of the child is changing to the psychology of an adult, allowing for the concept of becoming a reproductively capable individual, which means of becoming a parent to another generation in the future. So adolescence is not only physical and sexual maturity, but also emotional maturity. We're not mentioning it here, but remember that the psychological developments of adolescence are as important, if not more important, than the physical and biochemical developments. The last one, I think many of you are already here. Some of you are not yet here. Many of you are still in the late stages of adolescence. The change which will happen is that you will come to full growth, which means you will not grow, your bone length will fuse, right? Your ossifications will complete. Your long bones will become singular pieces. The cartilage stages will be completely over and they become completely bone stage. And maturity of all internal organ system, digestive tract, endocrine tract, renal system, you name it, all organs, all glands, all internal and external functions have become fully capable. That's when adulthood is gained. Maturity of all tissues, maturity of all organ systems allows this individual animal, the human being who is your patient, to function at full capacity. And you don't arrive at it for good 18 years, so it's one of the longest developments in the animal kingdom, in fact on the planet, and because it is one of the most sophisticated and most complex, which is why we have to help our patient at any stage when they come to us. Now, this first 4 stages comes under the specialty of pediatrics, and most doctors will only get to see adult patients because they will only deal with adult human beings, which is the larger subset of population. Children up to the age of 18 years are still less in number than all the human beings who are above 18 years, right? So we recognize it as a separate specialty because of the huge amount of growth and differentiation which is still needing to happen before we can say that this individual is an adult. So, welcome to embryology, and we will take it step by step and slowly make friends of this little person who we don't even know anything about yet, except that it's probably destined to become a human being. Bye for now. I think I can announce it right away. Tomorrow and day after, I will cancel my hour of 11 to 12 because this exam is taking up time and attention. Your seniors are priority right now. They have to be prepared for their university examination. We can resume classes on Friday. On Friday, I'll come back and take the class. For tomorrow and day after, I'll give you a break. You please read up the individual systems and we'll come back for Friday class. Thank you.